Hi, this is Dr. Dharanika Devi, oral diagnostician and radiologist from Dr. Wales Dentistry. There are 7S for the oral cancer and tongue cancer, of which first is smoking. Okay, as you all know, smoking is definitely dangerous for your health. And then alcohol, it is spirit S. Okay, so alcohol, for if you are using for the long term, definitely it is also one of the additional factors for the cancer. And then sharp tooth. You may wonder why sharp tooth is causing cancer, but if tooth is going to impinge mostly on your tongue or else on the cheek, there will be formation of ulcers initially, which is called traumatic ulcer. At that time, you will have certain kind of pain and all, but if you ignore, later you won't have much of pain. But inside, the ulcer is going to change into a cancer stage. Now, the S is sepsis, that is prolonged infection, which is going to be in your tooth or any other cause that is going to convert into a cancer. And then sunlight, if you are going to expose to a sunlight prolongedly, that is also going to cause some kind of cancer, which is not exactly the oral cancer, but yeah, definitely some kind of cancers. And then the syphilis something infection, of which also cancer may cause. And then spices, if you are going to take extreme amount of spices, if there is oral lesion, then definitely it is going to get converted into oral cancer. But before jumping directly into oral cancer, there are few certain conditions which is called as precancer lesion and precancerous condition, and at that time there will be white patch or else red patch will be seen on your mucosa, or else black pigmentation, everything. At that stage, if you're coming for the checkup, we will see all those things. So we will see all those changes of your mucosa, gum, teeth, everything. So it is an early stage. So if you're coming early, we can detect it early. Early detection save your life.